Hello, I'm Dr. Wendy Wong. This video is a general overview of what to expect before your surgery. You'll be getting a phone call from several people. The first one is Rachel, my surgery scheduler, who will coordinate your surgery date and all of your pre- and post-op appointments. The second one is Madison, my surgical liaison with Kinematic, who can tell you all about the custom surgical planning options with Kinematic. You may also get a phone call from one of our total joint navigators who will go over some home exercises and equipment needs with you. Several things should happen prior to your surgery. You will need to obtain medical clearance from your primary care doctor and any other specialists as directed by my scheduler. You will need to make sure that someone is there for you after surgery as your coach or coaches as discussed in our visit. Usually this is a family member or a friend. Ideally, someone should be there for you for 2 to 3 weeks after surgery if possible. I just want to make sure that you're safe. One important thing you should do is read over the surgical information packet provided in the folder. It will answer a lot of the common questions and give you a good overview of your surgical journey. I'm super excited to be your surgeon, and I look forward to making you better.